Hello. In unstable patients due to heart blocks causing bradyarrhythmias, the usual drugs of choice include using atropine bolus or dopamine or adrenaline, but we do not use drugs like dobutamine and noradrenaline, right? So the reason being that here I specifically want to talk about the drug that is dobutamine. So dobutamine is a beta receptor agonist, and it causes higher beta 2 agonism compared to beta 1 agonism, and that higher beta 2 agonism leads to drop in the systemic vascular resistance, and that drop in the systemic vascular resistance basically means there is drop in afterload, and it ultimately leads to drop in the blood pressure. And I do not want drop in blood pressure in a patient who is unstable, who is already hypertensive. But then we have heard about dobutamine as a drug used in cases of shock, right? And it is famous for being used in cases of cardiogenic shock. So where do we actually use dobutamine, and why? Like, how is it being used? Given the fact that the beta 2 agonism is leading to drop in the systemic vascular resistance and is leading to hypertension. This kind of seems like a very paradoxical situation. So it kind of is as well. So what happens is in cardiogenic shock, say due to a massive MI, blood pressure is low because the heart muscle is too weak to squeeze out the blood. Now what happens is the body is a great machine. The body senses it as the heart not pumping blood, so there is a deficit of blood in the blood vessels, or basically having lower pressure of blood in the blood vessels. So the body compensates this by increasing the systemic vascular resistance to keep the BP up. Now the problem with this is that the high systemic vascular resistance is basically the high afterload or a higher pressure that the heart has to encounter to push out that even little blood that it was able to push out earlier, because it is very weak. And that is why in this case dobutamine is so helpful, because it has both beta 2 as well as beta 1 agonism. Beta 2 helps in reduction of the SVR, or the systemic vascular resistance, so it is responsible for decreasing my afterload or the pressure against which the heart has to pump blood. And it also has beta 1 agonism, basically ionotropic effect. So it gives the heart a massive squeeze boost. So what is happening? That the heart now does not have to push against that high resistance that the body was offering initially due to the beta 2 agonism of dobutamine. Along with that, though it is weak, but due to the positive ionotropic effect that dobutamine is giving, my heart is able to push out a certain amount of blood, thus maintaining the cardiac output, thus ultimately stabilizing the blood pressure and the patient.